Welcome everyone to our second regional webinar for the Safeguarding Hub Eastern Europe. My name is Sarah Martin, and I'm the Regional Capacity Building Advisor for the Safeguarding Resource and Support Hub Eastern Europe. For those of you who are new to the Safeguarding Hub, let me give you a brief overview and invite you to check out our website where you can find a number of resources. So we are a resource for organizations and individuals in Eastern Europe who are responding to the war on Ukraine, and we provide practical and accessible safeguarding resources that aim to reduce harm to refugees and displaced people. We also have a global hub with many resources to help you in your safeguarding journey, and you can find more information about our regional hubs in the Middle East and in Asia and in Africa as well. But here in Eastern Europe, we know that people across the region have mobilized to welcome and offer hospitality to refugees and displaced people who fled the war on Ukraine, which started just over a year ago. Many organizations, both big and small, have been involved in the humanitarian response. Unfortunately, in the humanitarian community, we also know that in times of crisis, there can also be harm done by humanitarians. This harm can include sexual exploitation and abuse, discrimination, or even harassment. At the Safeguarding Hub Eastern Europe, we use the term safeguarding, which means preventing harm to people in the delivery of humanitarian assistance. This webinar is particularly focused on safeguarding older persons who've been impacted by the war on Ukraine. In 2022, Safeguarding Hub Eastern Europe conducted a country needs assessment to respond to the needs of refugees with disabilities in Poland, Romania, and Moldova. And we found that older persons were often included in the category of persons with disabilities. Older persons are not necessarily disabled, but their needs are often overlooked or grouped with disabilities in humanitarian response. So we decided to focus this webinar on learning more about the needs of older refugees and understanding the distinct risk that impact older refugees and displaced people in Eastern Europe and Ukraine. And we're going to focus a little bit on Moldova, where we'll have a presentation about the work that's happening there. You can get more information about safeguarding older persons in this emergency in our bite-sized document that is available on our website. I'll post the link later in the chat. So let me introduce our panelists for you. Our first speaker is Ms. Jo Dempster, who works with the Safeguarding Hub Eastern Europe as a disabilities specialist. Jo is a global safeguarding consultant specializing in disability inclusive safeguarding. She'll also be speaking about the findings from the bite-sized piece. We're then going to show you a short movie that was made by HelpAge with Ukrainian older persons called The Light in the Darkness. Our second speaker is Daniele Pedretti of HelpAge Moldova. Daniele has almost 20 years of experience in humanitarian work and development. Since July 2022, he's been the humanitarian manager for HelpAge in Moldova. Our third speaker is Lindsay Bingaman from HelpAge International. Lindsay has over 7 years of experience managing and providing technical support to programs in mental health and psychosocial support, protection, and gender-based violence in humanitarian and development contexts. She's been working as the Mental Health and Psychosocial Services and Protection Advisor for HelpAge International's Ukraine response since May 2022. You can find more about our fabulous panelists on our website where we have their full bios. So after the individual presentations in the movie, the panelists are going to have a discussion on the gaps in understanding safeguarding risks that humanitarian aid workers should be aware of. We're then going to open it up to questions from you. So please feel free to ask any questions by writing in the Q&A button. You can write in Polish, Romanian, or English because we have the capacity to read those and translate them. So without any further ado, I'd like to now turn it over to Jo Dempster.
Hi everyone. Thanks, Sarah. So as Sarah said, my name's Jo Dempster, and I've been working with the RSH Eastern Europe Hub for the last 6 months as their disability inclusion specialist. Thanks so much for taking the time to join today. We know that everyone's busy supporting the response, and it's not always easy to take time out to join these webinars. So it's great to see so many of you here today. Next slide, please. So just a note on terminology, as Sarah touched on, safeguarding is a relatively new concept, and we know that there's not one standardized definition. The text you see on this slide is how we at RSH define safeguarding. So it's about preventing and responding to harm to people in the delivery of development and humanitarian assistance, including harm perpetrated by those working for organisations delivering it. In terms of abuse, we know that older people have distinct safeguarding needs, and the abuse of older people is often overlooked when it comes to safeguarding. We are using the UN definition of abuse of older people. Abuse of older people is a single or repeated act or lack of appropriate action occurring within any relationship where there's an expectation of trust, which causes harm, distress to an older person. So we know that older people are more likely to be reliant on others for support, and we know that perpetrators of abuse or neglect are often those who are trusted and relied on, such as a family member or care staff. Next slide, please. So in terms of the regional landscape, there isn't disaggregated data by age, but the UNHCR data portal estimates that over 12 million people have been displaced by the war in Ukraine, and over 8 million have fled to neighbouring countries. Ukraine is classified as one of the oldest countries in the world, where people over 60 make up nearly 1/4 of the population. RSH has established hubs in Moldova, Poland and Romania, and we conducted the needs assessments that Sarah spoke about, and we found that older people were often lumped into the category of people with disabilities. We know that older people are not necessarily disabled. Many are in good health, full of vitality, and playing a key role in supporting their communities and families through the crisis. However, many do have disabling conditions and distinct needs, which are often overlooked and grouped with disabilities. Working with HelpAge, we felt it was so important to have a webinar that specifically focused on the needs of older people. Next slide, please. So what are the specific challenges of older refugees? Older people are often faced with emotional challenges about leaving their country of origin and seeking refuge in other countries. They tend to be at the later stages of their lives, and they may find themselves in a status of waiting to return and struggle to integrate into receiving countries. Just like in other countries, in Ukraine, older people are likely to have been valued for their wisdom, life experience, their authority, their status. In receiving communities, however, their position in society is likely to be challenged. Older refugees may become more dependent on family members, children or grandchildren for basic needs such as paying bills or reading correspondence. And as well as undermining their traditional authority, this can cause a sense of humiliation or shame for older people. So in essence, the process of displacement also displaces older people from their traditional roles. Age can also impact access to information. Information, we know, is often concentrated in digital spaces, on websites, social media apps, and this creates barriers for older refugees, particularly if they're visually impaired or have hearing difficulties, or they don't have access to the internet or smartphones. Consequently, older refugees are likely to have information about accessible services, including healthcare services and safeguarding reporting mechanisms. So just a note on intersectionality with disabilities. Well, we know many older people are in very good physical shape. According to the UN Department for Economic and Social Affairs, worldwide, more than 46% of older people do have disabling conditions, and therefore they do need access to healthcare. And we found that there are a limited number of humanitarian professionals with specific expertise in the healthcare needs of older people. And in terms of gender, we know that women are more at risk of violence and abuse and neglect. This is also true for older women. They tend to be poorer, they might have smaller pensions, they often have more caring responsibilities, and they're more often likely to be living alone. Next slide, please. So there are some groups of older people who are more at risk. Those who are separated from their families, who they might have relied on to meet their basic needs. Those who have physical disabilities or mobility challenges. We know that many older people who are physically unable to flee have been left behind. And we know that a lot of older people have been less likely to flee because their hardships associated with travel or reluctance to leave their home and land and possessions and everything they've ever known. Isolated older people who are carers for grandchildren or children, and they may become cut off from services. Isolated older couples or couples where one or both partners have a disability. Older people living with chronic illness or mental health conditions. And again, we know that older women are more at risk of abuse and neglect due to the fact that they're likely to be poorer or have less status in society. Next slide, please. So the World Health Organization estimates that 1 in 6 people over 60 have experienced some form of abuse annually. And that while there's no official data, we know that incidences of abuse increase in times of humanitarian crisis. Perpetrators of abuse or neglect are often people who are trusted and relied on by an older person, such as a family member or care staff. Older people can experience all types of abuse, including financial, material, physical, sexual, neglect, and discriminatory abuse. Sexual abuse of older people is often not talked about. And when it comes to sexual exploitation and abuse, people often don't think of older people as a target of SEA. There's a lot of stigma around SEA and older people, where safeguarding tends to focus on children, and sexual abuse of older people can be seen as a taboo subject. Next slide, please. So digging deeper into the safeguarding risks of older people are vulnerable to financial abuse, especially if they rely on someone controlling their money. This could be someone stealing valuables or while visiting their home or the place that they're staying in, a financial guardian spending funds inappropriately or coercing them to spend, internet or telephone scams. They're also particularly susceptible to gender-based violence, including domestic violence, which can sometimes be linked to dementia in both perpetrators and survivors. And this might include emotional abuse, sexual abuse, threats to hurt or abandon, isolating people to control them, humiliating, blaming, and controlling behavior, verbal abuse, unreasonable and unjustified withdrawal of services or support networks. Older people also experience domestic violence, and they can be more susceptible to this if they're isolated and don't have much contact with friends, family, or neighbors, if they have memory problems or difficulty in communicating, if they become dependent on their carer, if they have a difficult relationship with their carer, or if their carer relies on them for a home or financial or emotional support. The speed of the response and the lack of capacity within small organizations who are often partnering with larger INGOs has led to some unsafe recruitment processes of hosts, carers, and service providers. The research we did found that overwhelmingly organizations felt that those volunteering to support would not cause harm, that they were good people. And while this is true for the majority of volunteering, we know that perpetrators of abuse are often known to the survivor, and therefore ensuring robust recruitment measures are in place is vital. We found gaps in knowledge around what these should look like. For example, how reference checks should be carried out and criminal records checks. Finally, the UNHCR has established reporting mechanisms across the region. However, there are still questions around how accessible or known to older people these are. Next slide, please. So finally, I'm going to hand over to our colleagues at HelpAge, who I would say are the real experts in the region. Firstly, we're going to hear from Daniele about HelpAge's work in Moldova, and then from Lindsay to hear more about HelpAge's regional work. But first, I have the privilege of introducing this heartbreakingly lovely video, The Light in the Darkness, which shows some hardships facing older people, but also celebrates their incredible contribution. So just a note on the audio, the video is in Ukrainian with English subtitles. I really hope you enjoy the video, and I look forward to seeing you again soon.
Багато з нас вимушені були покинути свій дім, лишити усе у минулому.
Чи я виключила світло, зачинила вікно. Тисячі уламків звичок, спогадів та питань розривають наші серця кожного дня. нас немає іншого вибору. Ми маємо бути сильними.
Ми вдячні за те, що можемо сказати «ми». За ті секунди, в яких ми можемо сміятися. За те, що можемо відчувати ритм життя. За те, що ми живі.
У нас намагалися відібрати життя. Але ніхто і ні за що не відбере у нас нашу красу та любов.
Наші думки поглинула темінь. Але ми освітлюємо собі шлях нашими маленькими перемогами.
Ми змогли знайти нове місце в новому світі. Навіть у найтемніші часи ми зберігаємо надію, передавши полум'я любові нашим дітям.
Не дивлячись на вік, ми всі працюємо над спільною справою – берегти один одного.
Ми всі сплетені воєдино.
And now we will hear from Daniele Pedretti from HelpAge Moldova. Thank you, Daniele.
Thanks a lot, Sarah. Before I start talking about the situation here in Moldova, I just want to spend a few words about this video that we just saw. I think it's this video we wanted to show me and Lindsay because beside the fact that it's a good video, is that it shows the different phase of this war perceived by the older people. So you see in the first phase, they feel like helpless. They don't know what is going on. They don't know what to do. It's a big change of their life. But however, through the video, you will see that step by step, they adapt to this new life. They show their resilience. And at the end, not only they resume the old tasks that they were doing, like taking care of the kids, that they were doing the same back to Ukraine, back in the peace, when there was peace in Ukraine, but also these new tasks. And again, as we always say, this also is against the assumption that all the people needs help, all the people, they can't do anything else. So all the people are sometimes are a resource. And this is quite a very important message that we want to share with you. Okay, let's start now with the first slide, please. So this is very few words about HelpAge. You can see here our mission, our vision, our commitment. So HelpAge is a global network of organization focused on improving the life of all the people, empowering them to lead healthy, secure, and active life. And we are present in more than 70 countries all over the world. So overall, this is just the background. We have at the moment around 107,000 refugees from Moldova. Out of them, more or less 70,000 are older people. And the situation here, due to the crisis, we were facing an inflation rate of 30% in December. Now it's slightly better. However, this situation has a huge impact on not only on the older population all the refugees, but overall also on the older population here in Moldova. As you know, Moldova is one of the poorest countries in Europe, and this crisis had a huge impact on the finances of generally the Moldovans, but in particular of older people, that they have very low salaries and pension, and the inflation eroded their power. Just an important note is from the 1st of March, we have a new law here, this temporary protection. So each citizen or refugees from Ukraine is entitled to apply for a temporary protection status. Thanks to this temporary protection, the refugees has similar rights as the Moldovans, so we can find a job here. So we have quite a few volunteers here that are older people, because they understand better the issues and the problems of other older people. We also distribute food and hygiene kits in the racks and also in people living in the community. We also use this approach of home-based care that for all the people that are isolated. So through the community volunteers, these volunteers, they go and pay visits to the people that are living a little bit more isolated, or they are bedridden, bedbound. Then we have these community safe spaces in actually in 12 places here in Moldova, in 12 towns, where all the people can gather and participate in our activities. We also distributed some multi-purpose cash only to all the people, refugees. Yeah, and we were procuring and distributing assisting devices for people in need, for all the people in need. Next slide, please. We had two big assessments, and both of them, the main findings is that older people, they care a lot about their health. So the health was always, they were very much concerned about their health and everything that it was linked to their health, much more than food and accommodation and other issues. These are some of the data that we gathered. So not many people, as you see here, they have an official certificate of disability, but many people has different issues: seeing, hearing, and moving and climbing stairs, communicating, memorizing, and take care of themselves. So as again, for the statistic, 82% of all the people that we interviewed had at least one condition, and 51% had more than one condition. Then again, for the statistics, 48%, so meaning half of them, they reported that they could find all the medicines that they need. So only 50% they could find the medications that they need. The reasons were the costs, and the higher costs they can't afford, and the non-availability of the medication in the places where they are living. Please, next slide. As about the food, so this is a good news. It's a bit old, but however, the situation hasn't changed so much recently. 93% of all the refugees, they have no issue accessing food. So 86% they didn't have to reduce the quantity of food that they were eating before. And then, yeah, even in December, 57% they declared that they didn't have any issue with accessing the food. So you see that the situation is it's not improving. On the contrary, quite the contrary. However, there are many organizations working with food, with providing food. One of them is actually HelpAge. We are implementing a project with WFP. However, food is one of the issues that elderly people are facing at the moment, but health remains the first. So please, next slide. About the shelter, all the people, all of those older people living in the community, 69% they live with relatives and friends, and 27 in rented house and apartment. So here, just to give some other statistics, here in Moldova, most of the people that live in community, there are very few people living in RACs, as we call them, these centers. Yeah, so most of them, they live in the community. Let's go to another slide that is more interesting. So these are the key findings for protection. As you see, as I said before, 60% of refugees in the community reporting having to adopt a negative coping strategy. You see here the 4 top coping strategy. Something that is quite important is few of them, they don't have IDs. This is important also because without the ID, without an identification, you cannot access to many services. Some of them also, they have older version of IDs, handwritten, that it caused some issues with them. Let's go to the next slide. I have a couple of slides more. So this is quite important. The main safeguarding concern of older people in Moldova. Generally, we don't have data, so it is very difficult to prove. They have a broken social circle to rely on it, and this causes isolation. They can't get information on social media or on electronic devices because some of them, they don't know how to use it. They totally depend, some of them, on the caregivers. The personal data management, many organizations that are requesting data without proper explanation on the scope of these data requests. And generally speaking, for organizations, safeguarding is always perceived related to children and women, not to older people. So you go to the last slide. This is the main safeguarding measure in place. So we have a monitoring system in the RACs. So UN, NGOs, and social services, they are monitoring those living in the RACs. We always try, organizations, they always try to prevent and inform all the people of their rights. There is a code of conduct that each and every international organization has here on safeguarding, as far as I'm aware. We provided some trainings, when I say we, international organizations, on safeguarding to local actors, because sometimes safeguarding is quite a new concept here in Moldova. And then there is this network of the protection against sexual exploitation and abuse. We have reporting mechanisms, and each and every organization working here adopt these reporting mechanisms. And next slide, please. Just a few recommendations. You can read it yourself. However, the most important one is to have sex, all age, and disability disaggregated data. This is valid for all reports. And always try to engage with older people to understand their needs and strength. And as I mentioned at the very beginning of my intervention, don't assume that all older people are vulnerable. Sorry if I took more than 10 minutes that was dedicated to my presentation, but yeah.
Thank you so much, Daniele. That was okay, since we had a few problems. I'd just like to ask the Ukrainian interpreter to please check your messages. There seems to be a little bit of confusion with the channels. So now that we're straightening out the interpretation, and apologies for that. Thank you again, Daniele. And now we'll hear from Lindsay.
Okay, hi everyone. Just checking you can hear me okay.
Everything good.
Cool, great. Thanks to everyone for joining and for everything that's been discussed so far. So I'm going to talk about a really important part of this conversation, which is the resilience and strengths of older people, because I think that's not often the focus when we talk about this population. So I'll speak to that as well as some of the mental health and psychosocial support considerations when we're talking about older people and safeguarding. Next slide, please. So I want to share a few stories of some Ukrainians that I have met and my colleagues have met. I think all of these stories are from Ukraine. So displaced people still living in Ukraine, but that have been displaced from their homes. So this first woman here on the top left corner, her name is Lubo, and she's 85 years old. And I met her in Zaporizhia, and she was volunteering at a center for internally displaced people. She herself actually lives in Zaporizhia, but she decided that because she lost her family and she was living alone and she wanted to contribute. So she is volunteering every day to support others. And on the right top, we have here Vladimir. He's 65 years old, and he has in the past taught practical skills to civilian defenders, and now he's teaching chess. So he has poor eyesight and he needs surgery, but he's still wanting to share his skills with others. So here he is playing chess, and he's still sharing and teaching those skills with others. In the bottom left here, we have a mother and daughter. So this woman, she lives with her husband and her daughter in a small house. They were displaced too, and they're struggling to afford their medical expenses because they were displaced, their house was damaged, and they weren't able to get the support they needed to rebuild and fix their house. So now the three of them are living together in Bucha, and they are caring for one another. And then lastly here in the bottom right, we have mother and son. So Irina and her 81-year-old mother, I think Irina's not pictured here, but her mother is 81 years old, her son 41 years old, and the son has disabilities. So here you can see she's taking care of her son. And it just goes to show the strengths, the resilience, and the different capacities that older people have. And that's something that we really want to highlight and we want to tap into whenever we're talking about safeguarding and working in humanitarian contexts, because older people not only have oftentimes needs themselves, but they can support others as well. So I thought these stories would be nice to share. Next slide, please. So some of the mental health and psychosocial threats that older people face, and specifically this has come out of some research that HelpAge has done recently with older Ukrainians who have been displaced within Ukraine. And you can see here that 55% of older people who were surveyed for this research expressed that they feel the emotional impact of the war. And so this can look like distress, anxiety, and inability to perform daily tasks. And this is due to a range of things, from being separated from loved ones, loneliness, isolation, disagreements, and loss of loved ones. And we also know that older people are less likely to vacate their homes. And so either because they're physically unable to, they don't want to slow down their family members, or they choose to remain at home because in this situation, they might have been displaced multiple times in the past, and they want to be at home for the remaining years of their lives. But you can see here that despite this high percentage of emotional impact being felt, that only 2% are seeking out support from a specialist. And this is due to a variety of things. The two main things that we found is lack of information about the mental health services available, as well as a stigma around mental health. So that's something to consider whenever working with any populations, but specifically in the Ukraine response, we see that older people are a bit less open to using phrases like mental health and talking openly about their mental health, and because there's still a stigma attached to this. And yeah, also hidden disabilities are something that come out. So things like dementia that, you know, might not be a physical, you might not be able to physically see this. We also know that older women are more at risk, and I think we'll go into a little bit more about that later, but we found that, sorry, this came from the WHO, that 60% of people over 60 years old who have been affected by the war in Ukraine are women. And yeah, so please go to the next slide, and I will talk about some things to consider when working with older people and to support their mental health and psychosocial needs. So this here is the ISC MHPSS intervention pyramid, the Interagency Standing Committee together. And this is essentially to show the needs in a humanitarian emergency. So starting from the bottom, you see social considerations and basic security. So this is what everyone needs in an emergency. And that's kind of like, you know, the basic needs, we start there, this is to everyone. And then going up, it shows how less and less of the population require these different services. So what we at HelpAge do is we focus mostly on the bottom two layers of the pyramid here. So basic services, security, and strengthening community and family supports. So this is something to consider because we oftentimes throw around clinical phrases like trauma and PTSD, and we want to be careful to not overdiagnose or to use these terms when we're not, especially if we're not qualified to do so. And this can affect the services that are given to older people when you know, it might be in reality that they need to be connected to their existing support systems in their new communities, and given the support to find and connect to those communities. And so I mentioned this before, but it's just important to say again that you want to be mindful of the cultural context. So we found that many older people don't want to talk to a psychologist. They might not feel comfortable. And so what are the other support systems in place? Is it family, friends, neighbors, volunteers in the community that they can seek out support from? And they also, you know, it's important to note that the way that people process, and we've found that older people like to talk about their stories, their past, and maybe things from their past, World War II, their childhood, things will come up. And it's important to really give them space to discuss these stories, because that's a way that they can start to process and make sense of it. So listening is essential, probably one of the most important considerations to keep in mind. Spirituality and religion play an important role. So supporting older people to be able to continue to access their places of worship, for example, and then providing services like home-based care, which is what HelpAge, one of the services that HelpAge provides, sharing key information, befriending, so linking them up with others, and really, yeah, focusing on bringing them information and awareness about the situation. Next slide, please. So I started off, and what I want you to really take away from this is the strengths of older people. So in order to find out about their strengths and their capacities, as well as their needs, we need to listen. We need to, you know, assess their needs and not assume that all older people are the same. They're very diverse across the different age brackets and across different contexts. Do no harm. Of course, that's what we're all here to talk about today, safeguarding and doing no harm. And there's specific things to consider when working with older people. So ensuring that activities are dignified, participatory, so you involve older people, you ask them for their opinions, you get their feedback, and really let them drive the activities as much as possible. and make sure that all of the staff and partners that you work with are trained in safeguarding, as well as how to work with older people. And then referring. So whenever we aren't able to provide the older person with those specific services that you saw at the top of the pyramid on the last slide, making sure that we're referring them to other support and not overcommitting or overpromising to something that we can't do. And yeah, recognizing the skills that they can contribute as well to each other and to their peers. Next slide, please. So some of my colleagues here mentioned a few of the safeguarding risks faced by older people, and I'm just going to add a few others from my perspective. And actually, HelpAge's new Global Safeguarding Advisor, Heidi, was able to input some of her good knowledge here. So some of this comes from Heidi. Just wanted to say shout out to her. And so, yeah, so basically, I mentioned this before, but it's crucial that we're not making assumptions about the needs of older people. So including them in the planning is key, because we know that older people are more likely to live alone and be socially isolated. This increases their risk of harm and abuse. They might also be hesitant to report any abuses or complaints that they may have because they're afraid of their services being cut off. So that's something to keep in mind when you're thinking about how to create complaints and response mechanisms. And this is something I think I'll mention a bit later, but they need to be really accessible, and older people need to know their rights, know what they're entitled to, and know what's not okay as well, and what they should be reporting on, and to be confidential. And so some other risks could look like a lack of policy from the organization, and poor data protection could lead to safeguarding risks if older people's information is leaking out, getting into the wrong hands. And then overprotection is something I wanted to talk about, which we have seen a few cases of, which is when a caregiver is actually overprotecting and taking on more and more of the sort of day-to-day tasks, and because it's easier, it's faster for them, which is actually disempowering to the older person. So it's something to keep in mind, to them to be independent. We want them to be practicing these skills to be able to be on their own and independent, and not take that away from them. Please. So this is something that HelpAge put together for some tips when communicating with older people. So they might seem obvious, but it's really important to keep these in mind and to make sure your staff know more about this before interacting with older people. So we want to treat them with respect, and not only to talk to the caregiver. Sometimes if there's a caregiver there sort of speaking for them, it might be easy to just keep the older person out of the conversation altogether. And we really want to, again, empower them, bring them in, even if they can't participate, talk to them, really humanize the situation as much as you can, and treat them with dignity and respect. Make sure that your communication style and your materials are accessible, and you have a diverse set of messaging styles. Consider hearing difficulties, vision impairment, and again, listen. You don't have to fix things. I think that's our human nature, is to want to fix as soon as we hear somebody's pain, but oftentimes people just need an empathetic listening ear. And be culturally sensitive, of course, as in any situation, to know what the background is, know what the culture and religion and the norms are, and ask them about themselves, ask them for their needs, their strengths, their challenges, their input, and make sure that you're taking that into consideration. Next slide, please. So I wanted to touch on this because it's so important that we're also caring for our staff that are working with older people, because this is a difficult job. Staff in humanitarian settings, we know, are more at risk for burnout or compassion fatigue or even vicarious trauma. If you don't provide the proper training and ongoing support, that could in turn mean a lack of quality and could lead to further harm. So we want to make sure that we're taking care of ourselves first, so that way we're able to support those that we're working with better. So this is a duty of care, responsibility on the organization to make sure that they are putting things in place, things like pre-deployment screenings, ongoing support, post-deployment briefings, training, putting policies in place, and making sure that you have plans to support your staff and to create a culture of talking about staff well-being. Because I think that's really the most important part of the day-to-day workplace environment and culture, that people feel safe to talk about this, to ask for help, to ask for time off, which is key to doing this kind of difficult work. And then last slide, please. So how to reduce the risks. We talked a little bit about this, but some other ideas that I have. So including older people, I can't say that enough. We don't want to make decisions for them or assume that we know what's best for them, or that lumping them all into one category. We want to, like Daniele said, use sex, age, and disability disaggregated data. That's essential. And Daniele talked about that already. It's important that older people understand their rights, that staff understand how to work with older people and what their unique needs and strengths are, and what to look out for, what to be aware of. And so it's a specific skill set. We shouldn't assume that everyone, if you work in child protection, you can now understand how to protect older adults. It's very different. We need to be conducting risk assessments to figure out what are the safeguarding risks and to mitigate them before going in and responding, so that we're not doing more harm. Reducing myths and stigma around older people, that's key, and around mental health and psychosocial support as well. Making sure that all of your services are safe and accessible. So can older people actually access the services that you're providing? And ensuring that reporting mechanisms are accessible. So again, do older people know about them, know how to use them, know that they are entitled to them? And then supportive supervision for your staff, again, providing ongoing support so they can debrief and get support for some of the difficult work that they're doing. And I think I'll wrap it up there. Thank you. And I will hand it back over to Sarah.
Thank you so much, Lindsay. And now I'd like to invite all of our panelists to turn on their cameras. And I have a couple of questions for you, both from me and from the audience. So my first question is, and we only have 7 minutes left on the webinar, so I ask you to be concise. What are the biggest gaps that you see in safeguarding of older persons? One comment each. Joe, I'll ask you first.
Oh, it's quite hard with one comment. I mean, our research that we did in the region was really around lack of awareness and understanding of what safeguarding is. And then, added to that, talking about PSEA was a new concept for a lot of small organizations we spoke to, who the big INGOs are partnering with. And then added to that, then safeguarding older people and those specific needs. So it's kind of a lack of awareness and understanding from the organizations, also from the older people that the organizations are working with. And that sort of translated into lack of reporting mechanisms and not really getting a handle on the situation because of no disaggregated data. So sorry, that was not one sentence, but a few things.
Daniele, how about you?
Yeah, I think Joe summarized everything. I completely second what she said. just something about the information that you get. Older people, you always have to think that they not always use these devices. So you always have to provide the information in different ways. And the best way for older people is always just face-to-face. So other older people communicating with other older people or through volunteers, etc. Not only relying on one single way to share information. But what Jo said, it's totally correct, and I totally agree. Sorry.
Great, thank you. Lindsay?
I have a quick one that's more general to safeguarding, which is that I've seen that a challenge that seems like we're still all facing in this is that organizations often look at safeguarding as a checkbox to have you sign the policy and then go on your way. And we really need to be kind of mainstreaming that across all of our work and all of our programs, and making sure it's not just a tick box, but that we really understand what that means for all of the different specific populations that we work with.
Great. So my second question for you is about gender. So do you see a difference between the risks for older women versus older men? I know you touched on it, two of you a bit in your presentations, but maybe you could summarize at the end here. And that would be, yes. I would ask Lindsay first, then Daniele, then
okay.
Jim.
Okay, great. Thank you. I'm glad you asked this question, because this is something HelpAge found in the research that we recently did. The older women are more at risk, and we know that there are more of them, more older women in the Ukraine context right now that are affected by the war. They're more at risk. They have smaller pensions than men, and this is probably due to a lot of things, but they spent less time in the workforce because they were caring potentially for the children. They had caregiving duties. So their pensions are 30% lower than men. And women in Ukraine live longer. They live 10 years longer. So they're often living alone because their partner potentially died before them. And so, yeah, they are more at risk. And this is something that we need to be keeping in mind whenever we're working with them.
Okay, thank you. Daniele.
Yeah, again, I completely agree with my colleague. Something about men and is that it's a cultural thing. The men, they are expected to be more stronger in the culture of the Eastern Europe, and when they face issues like this, when they are in this kind of situation, they can't protect the others. So this is a problem that they feel shame, and it has a particular impact on their mental health. So you also have to take this into consideration.
Thank you. Yeah, really important to understand that. And Jo, the final word to you.
Yeah, again, totally agree with Lindsay and Daniele. And I think the other thing that I touched on in my presentation is around SEA and, the fact that it's very hidden, and older women or women are particularly susceptible to sexual abuse and violence. And I think there is a stigma around when we're talking about safeguarding and older people. It's just not, it's kind of almost a taboo subject. And I think, it's just really raising awareness that it happens. And also for the women themselves, making sure those reporting mechanisms are known, accessible, and there isn't a fear of reporting for services being cut that they really rely on. So yeah, just kind of, bringing that SEA angle in again.
Great. Thank you guys so much for highlighting that. I always care deeply about understanding the gender dynamics of these issues, and I found your presentations to be super fascinating. I hope everyone on board will be looking and thinking more carefully about older persons in safeguarding. So that's all the time we have for today. I'd like to thank Jo, Daniele, and Lindsay for their informative presentations, and to all of you that joined us today. I'd also like to thank our interpreters. It's really hard work to interpret live, and we're sorry again about some of the technological challenges, but we're very grateful to our interpreters who help keep us going. Also like to thank our Safeguarding Europe team, Betty, Annie, and Mariam, who are working behind the scenes to make this happen. In the chat, you'll have noticed that our national country managers, you can reach out to them. If you're in Moldova, you can talk to Dr. Angela Kara, Elena Kaforo in Romania, and Karolina Matkowicz in Poland. They can help you with any questions you have. At the regional level, please feel free to write to us on the help desk, and we will help you as much as we can. Again, it's available right now in English, Romanian, and Russian. You can write in Polish or Ukrainian, but we'll probably have to write back to you in English, but we're working on getting those languages on board. Please feel free to go to our website to download our bite-sized document where you can get a summary of all of these points that were raised today. And we'll be sharing this webinar and recording and slides with you shortly. So thanks again. And we'd also like to invite you to our next webinar that's happening on the 20th of April, where we're going to look more in depth about understanding survivor-centered approaches to investigations of SEA. You can register now on our website. Thank you so much, and we hope to connect with you again soon, and we'll see you in a few weeks. Bye-bye.